I'm your host, Mr. Trey Zeb, and on today's episode of Name That Imbalance, we have a patient who's been admitted with Hypokalemia! Isn't that exciting? Today's contestants are two first-year nursing students. Contestant number one is a nursing student from Wenatchee Valley College. Her hobbies include pushing meds, placing catheters, and doing carb counting for diabetic patients. Contestant number two is also from Wenatchee Valley College. His hobbies include writing concept maps, watching ATI videos, and doing pericare. Alright, contestants, tell us what you had to do to get here tonight.
I had to give 2 enemas and watch a stage 4 perineal tear.
Awesome. Contestant number one, how about you?
I got to give 3 enemas and do INO on a patient leaking from all orifices.
Here we have our patient, hypokalemic Hilda. She looks like she could use a hand.
Leave.
Okay, contestants, the first person to answer correctly in each category will get a point, and the winner will take home our lovely grand prizes. Here we have a brand new Littman stethoscope, a pack of 3,000 note cards, dry cleaning for a year to keep those nursing uniforms pearly white, and $10,000 gift card to Starbucks, because by the end of nursing school you will have spent about that much on your coffee drink as your tuition. We also have $500 towards your WVC printing balance for those instructors who make 300-page PowerPoint slides. And finally, this amazing stress relief kit to use during those times when you reach a breaking point during studying. Alright, remember contestants, our goal is to treat the patient's imbalance before the Cadillac hearse pulls up. So let's get on with it. Before we begin, we have a quick review of basic pathophysiology of hypokalemia for our folks at home. Development of hypokalemia occurs when the serum potassium concentration falls below 3.5 MEq per liter. Low serum potassium levels increase and difference in the amount of potassium between intracellular fluid and extracellular fluid. The increased difference between the fluid spaces reduces the excitability of cell membranes and nerve and muscle tissue, thereby making them less responsive to normal stimuli. Hypokalemia may result either from actual total body potassium loss or from movement of potassium from an extracellular fluid to an intracellular fluid, causing a relative decrease in the extracellular potassium level. Actual potassium depletion occurs when potassium loss is excessive or when potassium intake is not adequate to match normal potassium loss. Hypokalemia can be life-threatening because it affects every body system. Alright, let's get this show on the road. Our first question is, what is the etiology of hypokalemia?
Not eating enough bananas.
I have chronic or acute kidney disease, vomiting, diarrhea, loose use of loop diuretics or adrenal steroids, and Cushing syndrome.
Well, it looks like contestant number one has the correct answer! I'm sorry, contestant number two. Not eating enough bananas is not the correct answer. Chronic or acute kidney disease, use of loop diuretics or adrenal steroids, overuse of laxatives, vomiting, diarrhea, gastric suctioning, alcohol abuse, nutritional deficiency, diabetic ketoacidosis, Cushing syndrome, hypothermia, and prolonged administration of non-electrolyte containing IV fluids can all be an etiology of this electrolyte imbalance. Our patient is a fitness competitor who is in a fitness competition coming up in 5 days. She has been exercising for 3 hours a day and only has been drinking water and eating 1 hard-boiled egg per day, and has been taking laxatives and using diuretics she stole from her mother's medicine cabinet. Alright, contestant number one, looks like you're off to a good start. Let's see if you can keep it up. Contestant number two, we'll see. What are some signs and symptoms of hypokalemia?
Craving bananas.
Dysarrhythmias, constipation, frequent urination, muscle weakness and spasms, and palpitations.
Alright, contestant number one is right again! Sorry, contestant number two. Craving bananas is not a sign and symptom of hypokalemia. Some signs and symptoms of hypokalemia are dysrhythmias, constipation, palpitations, fatigue, muscle damage, frequent urination, muscle weakness or spasm, tingling, and numbness. So, tell us, Hilda, are you experiencing any of these symptoms?
I have to go pee. I feel
nauseous.
Good. Okay, contestants, you heard her. Let's move on and get hypokalemic Hilda the treatment she needs. Our next question is, what assessments will you perform on a hypokalemic patient? Go ahead, contestants. You are correct, contestant number 2. Looks like you are learning something in nursing school. Now come on over here and show us what you've got. Contestant number 2 will first assess the patient's respiratory status by assessing breath sounds, ease of respiratory effort, and rate and depth of respirations, as well as assessing color of nail beds and mucosal membranes. This assessment should be performed every 2 hours because respiratory insufficiency is a major cause of death. Cardiovascular assessment is done by palpating peripheral pulses, which may be thready and weak in a patient with hypokalemia. Pulses can range from very rapid to very slow, and dysrhythmias may be present, and these can lead to death, folks. Blood pressure will be measured in a lying, sitting, and standing position as orthostatic hypotension may occur. Decimal changes in a patient with hypokalemia include hypoactive bowel sounds, which our contestant will now auscultate in all 4 quadrants. To assess the extent of decreased paralysis, which is present in severe hypokalemia, the contestant will also assess for abdominal distension, constipation, nausea, and vomiting. The contestant will now perform a neurological assessment as patients with hypokalemia experience altered mental status and may have short-term irritability and anxiety, followed by lethargy and progresses to acute confusion and coma in severe hypokalemia. Now the contestant will check for Hilda's level of consciousness and orientation and have hypokalemic Hilda count by 3s, as patients with hypokalemia are unable to perform simple problem-solving skills. The contestant will now perform a strength test. Patients with hypokalemia have muscle weakness and decreased muscle tone, hypoactive reflexes, paralysis, and some patients have difficulty performing ADLs and may be too weak to stand. In addition to these assessments, the contestant will also obtain a patient history information and ask about prescription or over-the-counter drug use, any diseases or disorders, and obtain a thorough nutritional history. You did a great job, contestant number 2, but I'm still not sure I'd want you to be my nurse. But let's move on. All right, contestants. It looks like it's getting close. Contestant number 1, you'd better watch out. Contestant number 2 is not as dumb as they say. For our next question, name some risk factors of hypokalemia.
Not eating enough bananas.
Whoa, looks like you are correct, contestant number 1. Sorry, contestant number 2. Not eating enough bananas is not a risk factor for hypokalemia. Alright, folks at home, listen up. Some risk factors that may increase the risk of developing hypokalemia are kidney transplants or kidney problems/diseases, eating disorders, poor nutrition, alcoholism, and diabetes. Looks like our patient's poor nutrition over the last several days, along with excessive use of laxatives, diuretics, and exercise, have contributed to the development of hypokalemia. And I believe she is also at high risk for developing an eating disorder. Okay, contestants, enough silliness. Let's get on with it. For our next question, list appropriate drug interventions used to treat hypokalemia.
Potassium supplements.
Give a banana by sub-Q or IM injection.
Oh, contestant number 1 is right again. Sorry, contestant number 2. Bananas are not a drug and cannot be given by sub-Q or IM. What are you thinking? Appropriate drug interventions used to treat hypokalemia are oral potassium supplements such as potassium chloride, potassium gluconate, or potassium citrate. Potassium may also be given IV for severe hypokalemia and an infusion rate of no faster than 5 to 10 MEq per hour. Hypokalemic Hilda is not in a severe stage of hypokalemia yet. And remember, folks, these are first-year nursing students. And contrary to what contestant number 2 said, potassium should never be given IM or sub-Q injection, as it is a severe tissue irritant. Okay, contestant number 1, since you answered this question correctly, you will now have the opportunity to administer drug treatment to hypokalemic Hilda. Contestant number 1 will now administer potassium supplement PO per MD order and will instruct the patient to take it with meals and a full glass of water to avoid gastric irritation, and instruct the patient not to break or chew the tablet. Great job, contestant number 1. So, for our next question, what are some laboratory data or diagnostic procedures that can confirm hypokalemia? And the answer is...
ABGs.
Ask psychic Jean Dixon.
Contestant number 1 is right again. I'm sorry, contestant number 2. Asking psychic Jean Dixon is not the correct answer. Now, what you were thinking? Laboratory tests and diagnostic procedures that can confirm hypokalemia are serum potassium levels less than 3.5 MEq per liter, and arterial blood gases indicate metabolic alkalosis, where pH is greater than 7.45. Hypokalemia can also cause ECG changes in the heart, including ST segment depressions, flat or inverted T waves, and increased U waves. ECG will also show findings of dysrhythmias and ventricular tachycardia. All right, folks, we're on the home stretch. Contestant number 1 is in the lead with 5 points. However, this last question is worth 5 points, so contestant number 2 can still win this. For our last question, what patient education would you implement before discharging your patient?
Bananas.
Consume potassium-rich foods, proper use of laxatives and diuretics, do not abuse, maintain proper hydration.
The surprising turn of events, contestant number 2 is correct. All right, contestant number 2, since you answered correctly, you get to demonstrate patient teaching for all those folks at home. Contestant number 2 will now educate our patient on the importance of consuming potassium-rich foods, such as citrus fruits, bananas, dairy products, and avocados, to name a few. The patient will also be educated on the proper use of laxatives and diuretics, and on the importance of not abusing these medications, as well as the importance of maintaining proper hydration. Thanks again for joining us on another episode of Name That Imbalance! Hypokalemic Hilda has dodged a free ride in the Cadillac hearse and avoided complications from severe hypokalemia. That includes the following: paralytic ileus, paralysis, cardiac arrhythmias, and death. Until next time, I'm Mr. Trey Zeb. And remember, help control our pet population. Have your pets spayed or neutered. Goodbye.